on matters of digital health when it comes to telemedicine. And during that time, we said that in the future, nutrition is going to pick up so that we can have service delivered directly to the consumer without necessarily being employed by county government or national government. And I want to start from there because digital health is going to be that solution. We have so many quacks on the online platform teaching nutrition, but you are coming as the expert, and you must come out with competency that is going to help us provide a solution. The distance notwithstanding. And that is why digital health is going to be very, very important. And we know that the government of Kenya today has also thought about it and has come up with digital agency under the Digital Health Act so that we can digitalize medicine when it comes to offering services. And nutrition is not left out. And I want to believe this is the focus. The BBC saying that are you going to be replaced by artificial intelligence? And this keynote will answer that question very well. And be ready, because keynotes are boring, but they are very educative because they set the platform for further scientific knowledge. So, as a keynote also, I want to welcome you to my keynote. And I'll be teaching, not lecturing, I'll be teaching about empowering global, regional, and national nutrition and dietetics services with digital technology options. I have 3 slides which will be shown at different times, but I have main content in the content of the keynote address paper. Now, by way of introduction, you all know, you and I, we are in the health sector, and particularly as medical professionals. Under the Health Act, nutritionists are purely medical professionals and qualifies for any service area that a medical physician will be found. So if it is a health facility, we need nutritionists in every ward, including ICU. That is where we talk about the critical care nutritionists. And so we are all in the same game of service delivery for Kenyans. Now, in the topic, digital technologies currently are increasingly influencing aspects of human life worldwide, not just in Kenya, but also regionally and, of course, nationally, including food, nutrition, and, of course, general health. Most of the time, I don't want to talk about nutrition as a health matter. I always want to emphasize nutrition as a well-being matter. So I think that's one area that you must learn. So I'm always very careful, even when I'm among our fellow CEOs and also with the Ministry of Health, I don't define nutrition as a health matter, but as a well-being matter. But a well-being matter that has a stake in the health sector. If you look at it from that perspective, then digital health becomes critical also for nutrition. Now, I want to take you back to the aspect of technological breakthroughs in the food industry as well as technologies in the community industry. But coming to the public, we all know in 2020, the outbreak and of course the pandemic that came, which is called COVID-19. positive. Whether it was real or not, it is God who knows. But there was the COVID wave in terms of, I sometimes call it the COVID ghost. Are we together? It came as a pandemic. It brought issues globally, but it left something, a new thinking. And the new thinking is technology applied. Not only technology, but digital technology. Then now we are referred to as the digital era community. A discussion on digital technology in nutrition service delivery, both dietetics and pure nutrition, has been discussed globally and led by what I want you to put down, called NNED Pro. It's called NED Pro, NNEDPRO, NED Pro. This is a global institute of food, nutrition and health, together with International Academy of Nutrition Educators, collaborating with Biomedical Journal in Nutrition, Prevention and Health. So this is an annual summit which started many years ago, and it is discussing the new trend in digitalizing health. And when it was established in 2008, so far it has had many conferences like yours to discuss the role of digital health. And I would want to start with the current one called Building a Theory. And this theory is called a pandemic in the digital age theory. We will not be talking about digital health today if COVID didn't happen. True. How many of us were using Zoom? Of course, Skype was there before COVID. How many of us were using Google Meet before COVID? How many of us were attending to clients and patients before COVID using virtual techniques? It was not there. So COVID, in as much as it was a pandemic, it was also to our advantage for the new era. And so whether sick or not, whether far or not, you can still discuss matters of good health. Distance not, withstanding. And so that theory is called the COVID theory. Write it down. It's my theory. You will not find it anywhere. It is my own theory. I'm calling it the COVID theory. Now, as a potential service provider that want to go digital, to come up with a platform, I want you to have at the back of your mind the COVID theory. And what is this COVID theory? Now, the COVID-19 pandemic has been the foremost global health concern in the recent years and has caused unprecedented disruption to our health systems. In fact, the impact is now just beginning to be felt. During COVID, it was not yet felt. The impact is being felt now. In my own perspective, as a health scientist, I regarded it as a hoax. It was a lie, but a better lie. A better lie. There was a new era that the authors of COVID, I call them the authors because all the manufacturers, knew that if they bring it, then they would have a space for business in the digital world. That is one thing that no one has ever told us. But if I bring COVID to disrupt, then we start thinking, if somebody brought us the digital world and artificial intelligence before COVID, nobody would have thought it. So sometimes you cause chaos to bring a new idea. And that new idea becomes the solution for the world. That is the COVID theory. We know of the physical barriers that it brought. We know of restricted visits. We know of the staff shortages in our health facilities it brought. And we also know of the malnutrition that came with COVID-19 due to lack of resources to consume food. So we expect an increase in malnutrition and health-related problems. That is COVID theory. Unfortunately, health professionals have not promoted that theory. It is the time to promote that theory. But in what format? In the digital space. In the digital space. Some governments, we know, provide the solutions to their countries. We also know that as malnutrition was increasing, the international community, like World Health Organization, WFP, World Bank, they all came to provide solutions on matters of malnutrition, focusing on digital aspects of service delivery. If you read the history in the literature, you find that. Now, we are called the digital age. So you and I, we are digital age group. So you are a Gen Z, Professor is an ancestor, but we are all in the digital age. Are we together? Now, if you are all in the digital age, you had Dr. Stella say, don't leave the old behind. Are you hearing? And so, you lead in the digital space, and we must be factored in the digital space. So in this theory, we have seen many technological changes which are coming up, and the impact it has in the health sector, and the nutrition is not left out. So we now have a focus of the digital health is backed up by the COVID theory. Okeyo 2025. So it's not anybody's theory, it's my own theory. And it's going to inform us for digital space entry as professionals. So I want to give us the overview of the global digital health platforms, and that is what is I hope you are able to see that if you have good eyes. That slide you see up there. But in Africa, and then India comes in with 10. As from the east, then we have Kenya 7, leading among other African countries. It therefore means that Kenya has embraced a number of tools as we talk today. No wonder the digital health has become a priority for government. And government cannot think for you if you don't want to be a part of the process. Looking at that diagram, the largest proportion of digital tools for nutrition used is what we call the CAM Care. If you go to the next table, the CAM Care app is leading, and it is used by frontline health workers like you to come to support clients, facility transactions, and many other solutions of health. This is followed by the OpenSER. So what you have on the slide are the common digital platforms that are currently being used in Africa. And you can access them in the internet internet so that you can review them and think of your own, as I'm going to say in the next slide. So, if it is embraced by Kenya, and Africa is also taking the lead on digital platforms for health solution, then you as a nutritionist must start thinking of solutions using digital platform, where you don't think about who will employ you after graduation, but you think about how you will provide a solution that is beneficial and will make you earn money after graduation. And I will give you one case of one of you who has already started the process. So the essence of digital solution is for you to be empowered so that you will use the tool to deliver service at home, knowing the COVID theory is the background. COVID said, stay at home. Did you hear me? Stay at home. At one point I asked the then cabinet secretary, sir, you have told us to stay at home but you are outside. What is the problem? Did you hear me? Stay at home but you are outside. So if you want us to stay at home, please announce this thing from your bedroom. It is still in record. And we already started seeing that this is a new era coming up for people to work at home. So that you don't have to look for jobs at the county. Yes, we will have those who work at the county, but you can also provide a solution at home. But only if you have a digital platform that is going to help you provide that solution at home and make it effective, efficient. So, opportunities for the digital empowerment in the global nutrition. That is another key area. In this context, many discussions at these conferences and summits, including the KENDSA conference that is coming today and tomorrow, provides insight into what is described as a low-hanging fruit. A low-hanging fruit. And this low-hanging fruit is called digital technologies that could impact in nutrition research, one, for those who are in research, and nutrition practice. And then health service delivery. And not only that, food systems. So that's an opportunity that you have. And when you look at the review of literature from different countries, we have already such platforms. For example, My Food 24 is a platform that is very much being used in nutrition service delivery. You can just write My Food 24, then you can find what that is at your own time. It has promised to be efficient in digital technology offered to nutrition services. We have seen similar smart devices and wearables. How many of you know that you don't need now to go and use a thermometer to take blood pressure? We have smartwatches that gives you that symptom. And not only that, once they take the vitals, you can also calculate the health vitals indicators straight away, without necessarily using stadiometer weighing machine. You walk and your weight and height has been calculated, and you have BMI. Not only BMI, BIA, which also factors the body volume. And these are all on the wearables. That's a digital technology. We have seen that being used now. And also, we have also seen applications like apps being developed for dietetic management, like the Nutrient, for example. And the one that I'm going to show you, where one of you has developed for this country. Now, pointing at, in Kenya, we have our own Smart School Plus, which has been developed by a professional who graduated 8 years ago. She's now working at KENDSA Teaching and Referral Hospital, but running her own solution. I think she's there. Now, this professional has come up with what we call proprietary nutrition software, and it advances algorithm, if you understand that from the computer perspective, that creates highly personalized diet plans based on cultural dietary preferences with the local foods and a comprehensive information on health management system. And she's going to teach our professionals to use this tool very soon, so that you can offer nutrition service at home and you are paying online and you stay at home. And so if I need nutrition service, it is logging in, connecting, getting service, getting prescription, and paying 200,000 for consultation. And you stay at home. I'm making it to sound like it is easy money. I'm saying that because the last time I saw a receipt given to Professor Muka for 200,000 for attending to one patient in the hospital at home. He was not in the hospital. He was at the facility. But you must understand. So that has already come, and we congratulate her for that. You can also connect with her, and she's going to train as many of you as possible under regulated functions within KMTC. It is a powerful tool on diet and lifestyle changes. So that's an opportunity that you and I must consider. Now, we know that if you go to the UK today, we have several of such apps which you can copy. But our focus is to develop our own apps, which are cheaper and can be applied by us. And so, it is moving us towards nutrition entrepreneurship rather than job seeking. Why am I saying this? Many times you have asked, where are the jobs for nutrition? So many students run away from nutrition because they don't see jobs. And I would want to ask you, where are the jobs for the nurses? If the government is ready to export them. I will also ask you, where are the jobs for the medical doctors? You saw them on the streets. So we are all on the same boat. But then, being clever to get a space like what KENDSA is doing is going to help us push through. Just yesterday, I was talking to our fellow CEOs in the regulatory authorities. And they were telling us that we need to come together so that we write to the National Treasury to see if we can merge all regulatory authorities to get money from government. I told them I don't like speaking stupid ideas. Because we have never had money before. Therefore, you have to look for your own money now. If you don't know how to make money, come I teach you how to make money. And this is how we did it. When they were doing the SHA costing for services, which is also a digital platform, I literally refused that nutrition supplementation is not part of the support. Why? We were giving nutritionists space so that they can charge what they want at home. So if you offer service and prescribe supplements, then it is not controlled by the SHA regulations. So you can tell Okeyo that I'm going to charge you 50,000 if I go through this process. If it's under SHA, you'll be controlled, you can't charge more than 50,000. That is thinking. And that's how we need to think. Are we together? The same way church can be at home, in the same way you can have nutritionists working from home, but using this small gadget to offer services. But large-scale administrative health records that we have in the health facilities has made it important that we must have a digital platform to manage. As you do that at home, you'll have a bulk of data. And that is why digital agency was created, so that you can onboard